A number of COVID-19 cases are increasing across the province and in Niagara. Niagara's top doctor says growing cases within that region are raising major concerns. Matt Ingram has the latest.
Quite concerning that what's happening elsewhere in the GTA is now coming here.
From an average of 4 cases a day in recent weeks, Niagara has seen a spike in the number of COVID-19 cases this weekend, reporting 14 yesterday and another 24 today.
So that's quite the large jump we've had in the last couple of days.
Right now, no one in Niagara is being treated for COVID in hospital, but that could change. With 5 outbreaks of the virus in the region, Niagara's acting medical officer of health, Dr. Mustafa Hirji, is worried the spread could get out of hand and is asking people to limit their social interactions.
It's maybe time for us to pull inwards again, stop, tighten up that social circle a little bit and not be spending as much time as other people and maybe limit it to just our family as much as possible.
Hirji says he's very concerned about the number of cases who had significant contact with others in the community, something he says is driving the spike.
They're spending time with coworkers, with friends, with different family members, and that's leading to more risk of infection spreading to more people.
I don't call this a second wave. I call it a rebound peak.
Dr. Prabhat Jha, the director of the Centre of Global Health Research in Toronto, says the uptick in cases in Ontario is concentrated in the 20 to 40-year-old demographic because younger people are going out, seeing friends, and mixing together, with many choosing not to use the COVID tracing app. He says the lack of interest in the app is a failure of the federal and provincial governments.
There's been so little social marketing of this to teenagers and to younger adults. Bars and restaurants should have a very simple no app, no entry policy. So they will look at your phone and see if you've got the app, and only if you do would they allow you in.
Just yesterday, there was another large car meet attracting hundreds of young people, this one in Wasaga Beach. Many of the attendees did not appear to be following health guidelines. Hamilton police have promised to find and charge the organizers of last week's car meet in Ancaster, but have yet to announce any charges. Dr. Jha says while the meets may concern some, the chances of transmission at these outdoor events is low.
The big concern is closed indoor spaces. So what we are worried about are the basements where private parties are held, or we're worried about bars and karaoke places where people take off their masks.
In Niagara, Dr. Hirji says it's not just the 20 to 40 age demographic experiencing new cases, but he says public health is working on new social media campaigns targeting young people to try and get them to take the risk of infection more seriously. They've actually bought marketing data to understand the types of people most likely to put themselves in situations where the risk of infection is high and to try and craft a message that will resonate with them. Nicole.